So Diane, let's get started now describing for the people what is the difference between normal skin and sensitive skin.
Well, for the skin anatomy, it consists of three main layers. So the first layer is the epidermis, which is the outmost layer of the skin, and that's act as our protective barrier. Beneath of that is the dermis that keeps the skin strength and elasticity, and that's because of collagen fibers and the elastin. Last one is the hypodermis. Hypodermis keeps everything cushioned and regulates temperature. So now if you have normal skin, your skin barrier is more strong. It keeps everything irritants out and you are able to retain moisture. While on sensitive skin, it acts opposite. Your skin barrier is more weaker. The moisture is hard to retain and you are more prone to irritations like weather, skincare products, and sometimes it's stress.
I see. So basically, when we're talking about classifying your skin, it's the very first step when we try to understand what would be the next question, because now the next question will enlighten you much better why we asked this. So now we classify the skin, it's sensitive. The tricky points is there is a sensitive skin and there is reactive skin.
Exactly.
So how we know the difference, which is very small hairline between the difference, and trust me, a lot of therapists, they go through that problem, which is we find it out on our study as well. What is the difference? How we can classify the skin, it's actually sensitive, but it's not reactive. How we can enlighten the people much better?
Well, that's a really big misconception, mainly when I'm doing the facial. And then they were saying, oh, please, I have sensitive skin, so please be careful. And then I was like, okay, let me do the consultation and then do the proper pre-cleansing, remove the oil, excess pollution, and excess dirt. Then when I saw the bare skin, I just figured out that they're just reactive skin. So how to identify the reactive skin or sensitive skin? They may seem similar, but they have different behavior and origin. So sensitive skin, it's inborn. Genetically, your skin is more fragile and it's more delicate. It's also prone to irritation, so you need to be attentive or constant care about it. Also, it can link for some skin conditions like rosacea, dermatitis, or eczema. In case that you have those skin condition, you must seek for dermatologists because they are able to give you a oral medication or topical cream. Because as aestheticians, we are not able to diagnose and give a prescription on that such skin conditions. And reactive skin, it's reacting on different environmental factors like pollutions, skincare products, or any kind of stress that, give you some blushing. And if those irritants are washed away, your skin will be back to normal. So to simplify, sensitive skin, it's a permanent skin type, and reactive skin, it's a temporary skin condition. So knowing those two skin type can lead for you to get the proper skincare products.
I'm about to direct this word actually for any therapist or stylist are, doing the facial, most especially for the men side. Well, they try to avoid much education. This very transparent answer, it's for you guys. Why? Because clients don't know this and you have to do your homework. So if you don't know how to classify and identify if the skin in front of you is sensitive or reactive, you might be advising your client wrong and you will be responsible about his bad experience, and also you are going to waste his money because you are treating the wrong skin with the wrong treatments. So that's why I actually earlier give the advice for the people that they always should be very responsible about that.